Ladies and gentlemen, now we're going to know and throw some light on Nutricosmetics for skin, hair, and nails. To tell us about this topic, we have here with us an esteemed dermatologist. Please help me in welcoming on stage Dr. Rickson Pereira.
Hi, good evening, everyone. I'm Dr. Rickson Pereira. I'm a dermatologist in private practice in Khar, Bandra. And today, thank you to Meyer Vitabiotics for having me. It's a pleasure to be speaking to such a huge audience with mixed specialities. So, a wise man once said, "You are what you eat." And I think when it comes to the skin, it couldn't be, more truer. So, I personally believe that nutrition is very important in how an individual shapes themselves. We know that what is your skin, hair, nails, these are a sort of reflection of your internal health. They are an advertisement of good genes. So if everyone who wakes up with glowing skin or good hair, it's important in terms of this confidence and self-esteem. A good hair day can completely change a person's mood throughout the day. Or if you have glowing skin, you can, just feel more confident on that day. And negatively, what can happen is a simple zit. I've seen people completely losing it over one zit, or brides getting one pimple before their wedding and completely losing it. So that's how skin plays a very important role in confidence and self-esteem. And we know that the skin has various functions. It protects us from UV radiation. It's a barrier to the external environment. It protects against chemicals, pathogens. And nowadays, when we talk about healthy aging, I think healthy skin, hair, nails at any age will contribute to a more youthful appearance, and it positively affects your social and professional interactions. I think if you are well turned out, well groomed, I think because we all deal with patients, I think it makes a big difference it instills confidence in the patient that you're treating if you are yourself well turned out. So skin, hair, and nails are continuously exposed to external and internal influences, and they may undergo alterations leading to a wide range of disorders. So modern nutritional science is developing new insights in the relation of food intake and health. So very commonly, I routinely ask a dietary history to all my patients, because a lot of the skin conditions that we see, things like acne. Acne is one of the commonest conditions. We ask for a history of intake of sugar, dairy products, all of that. And we've seen that once you reduce these, the acne sort of settles. Or we have conditions called as acanthosis nigricans, where a person is eating a lot of high glycemic index foods, causing insulin resistance and hyperinsulinemia, and causing darkening of certain areas of the face. So dietary is something that I include in a lot of this, and we also know that the diet influences hormones, which influences, we get patients with PCOS who have acne, regular periods, all of that. So, and the simple history of their diet will tell you that their diet considerably lacks protein. There is a lot of ultra-processed food. People are not taking, high-quality, nutritious food. So, and these play a role. They influence the health of the skin and hair, because ultimately, like your integument, your skin, hair, these are, the way I see it is external, and they are luxury organs, and they are fast-growing organs. The cells are fast-growing in these organs. So it requires this optimal nutrition to grow in its best state. And any alterations in the diet or in the overall health can significantly affect these. And we see that commonly, say for example, if a person has COVID or influenza, and then we see that after 6 to 8 weeks, the hair starts to shed. You get acute telogen effluvium, or women who have low hemoglobin, low ferritin, they tend to develop this chronic telogen effluvium where the hair is constantly shedding. Typically women come to us that have been shedding hair for over 2 years, 3 years. And a simple blood test will reveal any nutritional deficiencies. Also, as we get older, it's not possible for us to eat everything in an optimal proportion, or even if we do eat, they may not get absorbed in the optimal proportions. We have a predominantly vegetarian diet, and we know vegetables contain a lot of anti-metabolites, and which may not allow certain minerals and all to get absorbed in optimal proportions. So processing food and all may not be the best. Some people may overcook, some people may undercook it, some people go on raw foods. So all of these do affect nutrient uptake. And I think dietitians would be the best people to guide people into what is the right weight, what is the right proportion, what is the right way, and what is the right way to process foods. So factors that affect skin, hair, and nail health are oxidative stress, lifestyle changes, aging, deficiency of micronutrients, hormonal changes, UV rays induced problems, because we are constantly, when you're out in the sun, the UV rays damage your DNA. The skin cell, DNA in the skin cells. And this manifests as, uneven pigmentation, hyperpigmentation, dark spots, dry skin and hair. As we get older, there's a definite change in the texture of the hair. It becomes thinner, more drier, and tends to frizz out more easily. If the hair quality is poor to begin with, it cannot withstand all the thermal treatments and processing that is done. So typically we see this repeated hair coloring can also make the hair, it damages the hair much more when you are nutrient deficient. So if the hair quality is not good, it may not be able to withstand some of the cosmetic treatments that are done for hair. Then hair fall, brittle nails. Brittle nails again we see very commonly in someone who has a poor protein intake. So basically what Nutricosmetics do, so Nutricosmetics is a concept where you take in, your nutrients, so the nutrients affects your skin health from the inside, whatever you consume. And the purpose is to support skin, hair, and nail health. You want to provide some of the micronutrients that are essential in optimal hair growth of skin and nails. You want them to be growing at their peak. And micronutrients play a very important role, because you have your macronutrients, you need your protein, carbs, fats, you need major food groups, your protein-rich food sources, vegetables, pulses, nuts, fruits, all of that. So all those are important, but the thing is that we all know that because of environmental degradation, the soil levels of nutrients are, minerals and all are lesser now. Studies have shown that. So you may not get certain vitamins and in their optimal proportions. If you overcook food, you may lose certain vitamins. If you pressure cook it, you can lose certain vitamins. So some of these need to be sort of supplemented, and a lot of people don't eat the right things. Their diets are completely, like if they're stressed out, they're preparing for an exam, working late, you don't pay attention to the diet, and that can negatively affect the skin and hair in the long run. So nutraceuticals have received recognition due to their nutritional benefits along with therapeutic effects and safety profile. They are a promising strategy for preventing, delaying, or minimizing premature aging of the skin and alleviating certain skin disorders. And they do promote skin health, so it manifests as increased radiance by reducing skin imperfections, increasing luminosity, and improving skin firmness from within. There are certain disorders of skin which are associated with certain deficiencies. So people with acne were found to be significantly low levels of blood of zinc, vitamin A, and vitamin E. Vitamin D is very low in acne and other inflammatory conditions. When we investigate psoriasis, patients with psoriasis, eczema, vitiligo, generally they have, I think that's an issue with the Indian population in general. Low levels of selenium have been documented in patients with acne, because in acne, one of the pathogenesis is lipid peroxidation, for which antioxidants are protective against that. And magnesium level was seen to be decreased in severe type of acne patients. I think again, vitamin D deficiency sort of correlates with magnesium deficiency. And patients who are on isotretinoin, they tend to, certain nutrients tend to get used up a little faster when you're on isotretinoin, such as biotin, vitamin D, folic acid. So these could be supplemented along with in acne patients who are on isotretinoin. And isotretinoin causes dermatitis, chylitis, it causes dryness, and a lot of this inflammation improves when you supplement with omega-3s, vitamin E. Also, as when it comes to the nails, nail is also a nutritional biomarker, and virtually every deficiency can affect the growth of nail in multiple manners. So, for a normal nail, plate growth, you require a variety of nutrients, and we know that iron deficiency causes koilonychia. If there is protein deficiency, it can cause brittle nails. So all of these can be associated with nutritional deficiencies. When it comes to the hair, we know hair is a very fast-growing organ, and hair is a tissue which likes consistency. If you shock it in any way, by way of a sudden change in lifestyle, sudden change in nutrition, or you're met with an illness, all of these can shock the hair, and typically the response is hair fall after 6 to 8 weeks and persists for about 2 months. So it's important, and we see that in many of our patients, when we investigate, there are multiple deficiencies when they come to us for simple hair consultation, but when we do investigation, we see multiple deficiencies. Typically in our practice, we see iron, zinc, vitamin D, B12, all of these are low. And the diet really lacks good quality protein. So studies have found associations between nutritional deficiency and variety of types of hair, including that's seen in chronic telogen effluvium, where the hair fall continues more than 6 months, and androgenetic alopecia, which is very common. Almost 50% of the men have it by age 50. That can be accelerated if you are if your lifestyle is very poor. So micronutrient deficiencies are an under-recognized phenomenon. They often cause skin, hair, and nail abnormalities. And typically when you supplement nutritionally, they do improve. And they can be the deficiencies can be primary or secondary, genetic or acquired, and at-risk individuals with things like impaired absorption because of irritable bowel or inflammatory bowel disease and multiple nutrient deficiencies. So the skin is a sensitive indicator of nutritional deficiencies, and the most effective way to improve the skin condition is by providing essential nutrients internally. And dermatological manifestation of systemic diseases produce distinctive and reliable diagnostic clues that hasten the time to intervention and overall outcomes. So diseases themselves can affect the skin, and sometimes therapy can affect the skin. We've seen patients who are on statins, they typically after 3 or 4 years, they do develop very dry skin and eczema-prone skin. So therapy, or sometimes when you're on isotretinoin for acne, your skin can become very dry. So these are some of the medicines that can affect the skin. So biotin, let's look at some of the micronutrients individually. So we have biotin, which is important for hair growth, and we've seen that if there is a deficiency, which usually is rare, but a deficiency can affect the growth of the skin and hair, and generally certain conditions such as loose anagen, familial uncombable hair syndrome, all of these can improve with biotin supplementation. Also, biotin can be given both orally and it can be topically, it can be absorbed. We've seen that zinc deficiency commonly accompanies inflammatory skin disorders such as psoriasis, atopic dermatitis, chronic telogen effluvium, vitiligo, acne vulgaris, because zinc has an anti-inflammatory effect, and it is important in the maintenance of the skin barrier. It's important for hair growth, and it is important for the formation of certain cytokines. And the combination of zinc and selenium is synergistic, so it enhances the antioxidant defense system, leading to healthier hair and healthier skin. Then another ingredient in that helps is the grapeseed extract, which has something called as proanthocyanidins, and these work like oral sunscreens. So when the UV light hits the skin cells, the DNA undergoes certain chemical changes. You get something called as photoadducts, or purine and pyrimidine dimers. And antioxidants actually prevent this damage. So these antioxidants actually go and deposit in the skin. There are more than different types of oral sunscreens that are available, but grapeseed extract is one of them. And then you have other micronutrients such as vitamin C, vitamin E, vitamin D, selenium, silicon. All of these are important to skin health. So let's look at some of the evidence. There's some published literature on effect of dietary supplement for skin moisturizing in healthy adults. And so we have Perfectil. And it was a 3-month, so in a trial of 3 months with 125 subjects, I mean, the analysis, their skin, hair, and nail improvement was studied, and see, most people, more than 50% of patients improved, they reported an improvement in 1 month, and after 3 months, the number was anywhere between 85 to 95%. And subjects noted an improvement in the dryness and flaking, reduced greasiness. There was, I mean, the complexion improved, acne, eczema spots reduced. Then the hair texture improved, and the nail growth improved. And you know, internationally, when people have this whole 4 to 5 months of severe winter, they've done a study to show if a multivitamin supplement, Perfectil, can help, if it can help beat the you know, skin damage in winters. And so that study showed that Perfectil is a viable option for those looking to prevent the detrimental effects of cold weather. Mainly, people tend to get itchy skin, dry skin, and you know, dietary patterns change in cold weather in some of these countries, but it was shown to be as very effective. In a second, second trial also sort of corroborated the same thing. 2 tablets of Perfectil were given every day for 4 months. And so it was shown that skin aging and seasonal variation was slowed down with regular supplementation of micronutrients. Again, with nail growth, oral supplementation was shown to improve nail growth, nail quality and growth. And so the supplement was given for about 3 months, and the growth was tracked, and they noticed a faster rate of growth over 3 months. Thank you.
Thank you very much, Dr. Pereira.
Thanks for having me.
And you showed, you very kindly showed our 2 trials. One was from the UK and one was from France. The first trial was done before my time, but the second trial I participated in France, and it was one of the best trials ever done on a nutraceutical product. Although it was done in very cold conditions, but they can apply to the Indian context as well, because here the extreme is on the other side, that it's a hot tropical climate. And the trial actually didn't show the effect of cold weather. The trial was meant to show the effect of harshness of weather. Anyway, I have only 2 questions, and they're very related. You mentioned about addition of a VMS, a multivitamin supplement, to standard medicines. How easy is it to keep your patient compliant on that? And is the non-compliance anything to do with awareness?
I think micronutrients have their role to play in a person's, in a person's day-to-day life, because you know, everybody wants to be active and at the peak of their health. It's never, you can have like good micronutrient supplementation and have a bad diet, and you can completely undo everything. So I feel it's like nutrition, good nutrition has its place. Micronutrients have their place. Sometimes if the nutrition is really good and they are a little non-compliant with supplement, it is still fine. But occasionally what happens is they do take the micronutrients regularly, but their diet is bad. So I feel like a micronutrient supplement is important, but it's not something that replaces your basic nutrition.
Of course, very well said. And finally, how would you think dietitians can contribute to bringing about the awareness or making people actually use a supplement like Perfectil?
So the thing is that nutritional awareness among general population as well as doctors is not the best. And I can see that in all my patient consultations, they have all these fixed ideas and notions that this is good, this is bad. When we deal with patients with psoriasis, eczema, vitiligo, typically they'll ask us, what should I exclude from my diet? What should I not do? And I have had patients who have excluded so many things from their diet for, in the hope that their vitiligo will be cured. So there are a lot of misconceptions, and we have to sort of fight that, because ultimately it leads to nutritional deficiencies, avoiding things in your diet. I feel that one should have a well-rounded diet. You have to have variation in the diet. We were talking about gut dysbiosis in gut health. Prebiotics are very important. What you feed yourself is very important in the way your gut microbiome will develop.
Would that show on your skin as well?
Absolutely. And a diet which is very varied. There are people who will pick up 5 vegetables and they will only eat that week after week after week. So, they'll not, so major food groups are left out. People, even if you see, although we are a vegetarian country, but our diets are very grain heavy. People will take like a huge, this plate of rice and a little bit of dal and a little bit of vegetable. So it causes a nutrient imbalance, and especially we are in insulin resistance is a very common problem in India, because I've seen teenagers developing pre-diabetes because of bad diets, or because they're not eating it in the right proportions. So I think dietitians have a very important role in spreading awareness about nutrition and even correcting nutrition. Sometimes it's not, although I give like an overall idea of what needs to be done, but I think a dietitian would be in a better position to sort of chalk out the day-to-day things that they can consume.
So a dietitian here has a big responsibility to make you beauty from within.
Right. Yeah, I totally believe that. And I mean, I take all my supplements and I take all my meds, and I feel that it has made a difference. And I think as doctors, we need to set examples for our patients, something that they look up to or aspire wherever possible. So yeah, I totally believe in beauty from within, and I think nutrition plays a very important role in how the individual shapes up, including their skin and hair and overall health.
Would you say you take Perfectil for your hair?
Actually, I do. I do take Perfectil. Okay. I keep rotating between Perfectil, Wellman hair folic. So it's a rotation. Sometimes I take Patchex also for brightening the skin. That is a good level of plant-based antioxidants. So,
okay. Sorry, that was a cheeky question. That wasn't in the list originally. I just made it up.
No, but I totally take all your supplements. I mean,
thank you.
I've been doing that for years now.
Thank you, doctor. Moving on to the next session. Thank you.